All right, good morning, everyone. My name is Chris Appleton, and I am the founder and CEO of Art Pharmacy. I'm based here in Atlanta and spent my entire career building organizations that integrate arts and culture into other industries. Also based in Atlanta, Art Pharmacy has been working with health systems and payers to increase access to mental health services since April of 2022. We will, this year we'll work with health plans. This year, we'll work with health plans and health systems in California, Georgia, Massachusetts, and New York. I'm very fortunate to work with a wonderful team of healthcare leaders, medical faculty, successful entrepreneurs, and arts and culture professionals. We've got a full-time team of 5 and a deep bench of consultants and advisors from Harvard, Northwestern, and Emory, to name a few. Daily, if not hourly, we get news alerts about the mental health crisis in America. I don't need to tell anybody on this call that. There are a number of reasons for this situation that are likely obvious. Social media, increase in social isolation caused by the pandemic, and an overburdened mental health care system, to name a few. More than 20% of the US population will suffer from a mental health disorder in 2023, and more than 50% of us in our lifetime. Generally, in the United States, we acknowledge mental health disorders or behavioral health disorders like anxiety or depression disorders as biopsychosocial diseases. Our healthcare system is built to address the bio and psycho components. However, it is not built to address the social leg of the stool. So I'll tell you a little bit about our approach. Art Pharmacy marries 2 fields of research. The first is the arts and health field. For 40 plus years, researchers at Harvard, Duke, Hopkins, and other leading research institutions have studied the effect of arts and culture engagement on health. The other is a concept called social prescribing, through which healthcare providers prescribe social interventions as a supplement or augmentation to more traditional medical care. You might be asking, will doctors prescribe arts engagements and will health plans pay for it? Short answer is yes. Long answer is it's complicated. But we do have partnerships with Medicaid managed care organizations like CareSource and United Healthcare, state of Massachusetts. Beginning in September, Stanford students will have access to Art Pharmacy's student health and wellness benefit. We bill 3 models. We've got 3 billing models. We've got a PMPM model for our population health and preventative health programs, value-based arrangements with managed care, Medicaid, Medicare Advantage plans, and then fee for service. We've got CPT codes. We're enrolled with CMS as a provider. Art Pharmacy sells to managed care and value-based provider groups. We've got an emerging strategic partnership with Optum's Behavioral Health Product Group, initially rolling out in Virginia. So I'll talk a little bit about how it works from a patient's perspective. A patient is screened by their healthcare providers. It could be primary care, behavioral health, chronic disease, for mental health concerns like social isolation, anxiety or depression disorders. If a concern is present, the provider refers the patient to Art Pharmacy, where using our smart matching technology, the patient connects to existing arts and culture engagements with protective and therapeutic benefits to their mental health. We measure their progress, provide data back to the referring provider to assist with patient monitoring outside of the clinical setting. Our software incorporates patient monitoring communications, a smart matching recommendation engine for arts engagements, and closed loop referrals. When we receive an electronic referral from providers and after the patient completes an intake, our system creates a patient profile built on dozens of variables, clinical data, SDOH information, patient preferences around arts and culture. And then on the other end of the algorithm, each and every instance of an arts engagement has its very own profile based on many of the same variables, but also thinking about the peer-reviewed literature and our own learnings about the highest efficacy arts engagements for the specific patient profiles. So for example, when an adolescent, when a teenage girl comes into the platform with a social anxiety disorder, the algorithm might recommend to her a group dance class because research has shown that that particular activity is most effective for that patient profile. So what I mean about by arts engagements, well, we think about them across a few domains. So artistic disciplines, so visual art, music, dance, and so on. The delivery modes, in person or virtual. The types of experiences, these range from workshops and classes to performances, or even tours of exhibitions, and then participation modes. And this is certainly very important. Group engagements, individual engagements, and then participatory versus receptive. And what we mean by that is participatory or active, being in a painting class where you're engaged in the art making yourself, or more receptive, sitting in the audience at a theater performance. Now, Art Pharmacy is not the direct service provider of these arts engagements. We buy them from your local theater, museum, dance studio, and so on, and connect the patient to these resources that are already in their community. We are very serious about impact. We use the WHO-5 as our standard measurement tool, though we have other measures. For patients that have received a full course of treatment, we've seen a net 22% improvement in WHO-5 scores. That's a emotional well-being index, and then a greater than 70% adherence to treatment plans. So I will pause there and answer what questions you all have. Thanks a lot.
Awesome, Chris. Couple questions coming in the chat here. First one from Jay: how long does the doctor prescribe the course of treatment?
The treatment plans vary. The standard treatment plan and dosage is 6 doses of arts and culture over a 6-month period, so it's once a month. But there's variability depending on the patient profile, the disease profile, the payer's appetite for longer or shorter doses, but there are options for refills as well.
Got it. And then on that point, you mentioned kind of, the model A, B, C, based on who you're selling to and how it works. What are your thoughts on what you're seeing sort of, working today? And as you envision this, taking off in 5 to 10 years, how do those models shift, or what becomes the dominant model?
Yeah, I think value-based and PMPM is certainly will be much more common, not just in the long term, but in the near term for us. With chronic disease, for example, I was sharing with some folks in the breakout. We've got a emerging partnership with a type 2 diabetes prevention and management program that's looking to boost patient mental health. And for that model, chronic disease, it'll be a PMPM model. Whereas for sort of straight mental health services, I think a value-based approach, and that's what we have with Optum and United Healthcare. Our CPT codes cover about 80% of what we want to bill on a value-based approach. So what happens is we bill a value-based rate to the managed care plan, and they turn around. That's 80% of, or excuse me, we bill $150 to the managed care plan, and then they turn around and bill the state Medicaid office about 80% of that 120, which is what CPT codes cover.
Got it. And then from a patient, sounds like you're going through the plans and the providers. Is there any consumer play, or would patients go in requesting this of their providers?
We definitely want patients going in, and do have patients going in requesting it of their providers. We know that someday in the future we'll probably have a self-pay direct to consumer option, but we are an enterprise sales model, and that's the way we are going now.
Got it. Well, cool. Well, any other questions, feel free to put in the chat for Chris. But Chris, appreciate you sharing Art Pharmacy and what you're working on.
Thanks, everybody.
All right. And then last but not least, Barrett from Wellstory.
Awesome. Thanks, AT. I'll get this pulled up in a second. Appreciate you bearing with me too. I'm a little bit under the weather today. Awesome. Well, hello, everyone. My name is Barrett Merrill. As mentioned, I am the founder of Wellstory. We are focused on transforming the psychotherapy experience for clients and the clinicians. So just real quick, as a high level, I'm from Atlanta. I've been in Birmingham, Alabama for about 10 years. So I just moved back with my wife and my 1-year-old a few months ago and was grateful to connect with AT last month and be able to join this morning for the first time. But I have a background in SaaS sales, worked for a couple scaling companies in Birmingham over the last few years. My wife is a psychotherapist and a clinician. She works here at a trauma center. And so just over the last 5 years, we've been very enthusiastic about the mental health and the psychotherapy space. Wellstory has been kind of a pipeline dream for quite a while, but we're excited to really jump into this startup over the last 12 to 18 months. I am a fellow of the What If Ventures Mental Health Syndicate program. They have a syndicate fund and also an accelerator program, which really kind of catalyzed us jumping into this project a little over a year ago. And then we've had some great traction so far. We are very early stage, but we had a great and a successful pilot in Q1 of this year, and then we launched just about a month and a half ago. And so we are, post revenue, we have about 20 clinics that are utilizing Wellstory so far, and just really excited to continue growing over time, and just especially in this relocation to Atlanta as well. So the core problem that we're focused on, and this was something I initially experienced 5-6 years ago when I first started seeing a therapist as a client, and then also just in connecting with the psychotherapy community, just really quickly realized there's a massive engagement gap when it comes to ensuring client progress. Therapists, as we've met with and connected with over time, struggle with clerical inefficiency and also client retention. Now, simultaneously, from a client perspective, clients lack tools to continue to engage in their therapy journey between sessions, not to mention tracking outcomes and creating some type of system of accountability for personal life application. And so when we first started looking at what's out there, what's in the market currently, we quickly saw that today's solutions really are not solving for client engagement. You've probably seen a lot of the studies over the last couple of years that have come out that self-guided mental health apps, a lot of these consumer apps, are really proving ineffective. Over 96% of them go uninstalled within 14 days. A lot of them are not evidence-based. Simultaneously, we do see a lot of the research showing that clients who do adhere to clinical homework see much higher outcomes than those who do not clearly see a reduction in personal outcomes. And so that really set us on a journey to create a SaaS platform for therapy homework that really bridges this engagement gap between sessions while also strengthening the therapeutic alliance within the behavioral health space. So as mentioned, we've been meeting with tons of therapists. We've met with over 200 in the last year and a half. We've had a lot of incredible feedback. These are everything from solo practitioners to SMB, small private practices, to agencies with several hundred therapists underneath them. We've been excited to hear and just learn from them. And what we've seen over, just throughout this discovery, throughout the pilot, is what therapists are asking for is really not on the market as a solution specifically for psychotherapists at this point. First and foremost, therapists are looking for a shared therapist-client interface. So something that's more collaborative, creates more accountability, and allows for customized and also automated treatment planning that resources clients with different types of behavioral health digital tools. Also looking for things that are both track qualitative and quantitative data. So something that's very method adaptive. So whether you're, focused on CBT and solutions brief therapy, or you're doing IFS or narrative therapy, creating a system that is very modality neutral and adaptive to the client needs. And then also, of course, communication and HIPAA compliance. Now, something that's very unique about our model is while we are initially launching as a B2B system, over the next year, we are honing in on a consumer application. And so something we've seen as a trend, especially with younger demographic of clients, is that we're seeing clients who are seeing 2, 3, 4 different therapists over time. And so being able to allow clients to preserve their data. So whether it's a journal entry or an emotion log, or a variety of other tools that are tracking their data and outcomes, being able to preserve that data, utilizing certain features still in a DIY and a consumer app format, but then allowing that to be transferable over time to future clinicians as well. So just I'll walk through a couple screens just as a kind of an illustration of what our platform is to date so far, and then can shift over to some questions. But so from a high level, kind of our beta platform to date is focused on our core activity center feature. And so right here, you'll see clinicians are able to go in, select their variety of clients. They can template different activities, but they can submit those to their clients and track their client engagement on those specific features, on those specific activities to see just more habits and trends over time. From there, they can go in and break down and observe different types of responses to each of these features. So, even yesterday I was meeting with a grief therapist who does a little bit of CBT, a little bit of acceptance and commitment therapy. And we talked through, it would be important or very helpful for them to track moods. What are their responses to certain prompt questions based off of their previous sessions, and observe what are those kind of between session activities for the client. We also focus heavily on assessments. So we have a lot of the traditional DSM assessments already templated in our platform, but also an area for custom HIPAA compliant assessments that can be created and templated and automatically sent to individual clients. And so it creates a tracking component to clients' responses. And then on the back end, from a client perspective, we have both our mobile and our desktop view of the platform. So just centralizing a lot of these core features. A lot of clients are being referred to 3, 4, 5 different DIY consumer apps, whether it's Headspace or Dailyo or Medify. And so we're taking a lot of these core features, centralizing them into one dashboard. So it just really streamlines and enhances that experience from a client perspective. So that's all I have for now. But again, excited to be here and happy to answer any questions.
Great. Thanks, Barrett. And if folks have questions, put them in the chat here and we'll call them out. Question for you of absent Wellstory. Talk a little bit more about how the therapists are engaging with their patients today outside of office visits.
Yeah, absolutely. So what we've really seen as kind of the trajectory was, we saw consumer apps coming out. We progressively saw from there telehealth, from there EHRs. One of our board of advisors is from one of the largest psychotherapy EHRs, Theranest, which is actually in Birmingham. But what we've seen right now is that while that's for practice management, that there's really a gap in terms of engaging clients. Most of the time it's paper worksheets from resources we love, like a therapist aid or a positive psychology. But it's usually paper worksheets or consumer apps. And so right now there's truly a gap in terms of how those resources are transferred to clients and actually tracking more on the client engagement side.
Got it. Thanks. Question here from Steve. Couple questions. Part one is, what's the experience like for the client? Are they installing your app, mobile website, desktop? Are they integrated with Headspace at all?
Right. So right now, great engagement. We're seeing, so our mobile app is coming out fully in a couple of weeks. And so that's been one engagement reduction. But in terms of, tracking micro engagements, whether it's, 15 seconds to log a mood log, 1 to 2 minutes to do a bullet journal entry, 5 minutes to record a grounding or body awareness exercise or an assessment, we're seeing that clients are responding I would say the biggest challenge, right, is psychotherapists do not have a ton of marginal time. And so I think the onboarding process is something that we're working on, continuing to streamline to help clinicians template the activities that they want to utilize so that it ultimately, continues to support clients past those first few sessions.
Got it. Well, great. Well, thanks, Barrett. Let me ask one last question to each of the three presenters here, and then we'll wrap up. Barrett, I'll start with you. What is one thing that this audience can do to help you?
Yeah, absolutely. I think being, so early stage, we're excited to be onboarding psychotherapists. And I think especially, coming back to Atlanta from Birmingham and reacclimating to this ecosystem is just connecting with, more practices, psychotherapists, and just really spreading awareness to the, particularly the clinical mental health community.
Great. All right, Chris, I'll ask you the same question. What's one thing that this audience can do to help you? Well, you got a lot of folks here on the meeting.
Email your doctor or health plan with me copied, chris@artpharmacy.co, asking them if they can prescribe arts engagements for your mental health support.
And specifically there, Chris, doctor or health provider or
health plan
or both?
Or your health plan.
Okay.
Yeah, your physician or your health plan.
Got it.